The following are your post-operative instructions provided by Central Michigan Group, the Office of Dr. Joseph Morrow. Please follow along as all these instructions are written down. The first hour you arrive home, you should rest. The second hour, begin to take in 6 to 8 ounces of a clear liquid. Clear, meaning see-through, not necessarily clear in color, such as pop, juice, tea, Gatorade, or water. The whole idea is to have something on your tummy before the third hour when we ask that you take your pain medication. You may not be experiencing pain at this time, but it is wise to begin the pain medication so you're comfortable as the anesthesia wears off. The fourth hour, if you can tolerate it, please begin your antibiotic. Typically, the antibiotic is taken every 6 hours, so please begin this at a time that fits your schedule. To avoid a dry socket, do not rinse, spit, or use a straw for the next 24 hours. You should refrain from smoking or chewing tobacco for 7 to 10 days. To help reduce swelling, you should apply an ice pack directly over the surgical area, 20 minutes on, 20 minutes off for the first 24 hours while you're awake. After 24 hours, please do not use ice. Use heat. Heat can be applied to the area until the swelling is gone, in the same manner, 20 minutes on, 20 minutes off. Swelling will generally reach its maximum in 3 days. Moderate bleeding may occur after your procedure. This can be controlled by placing gauze over the surgical area and applying pressure. To change the gauze, use the gauze that is in the white envelopes in your goodie bag. Please take 3 gauze squares, stack them, fold them into a quarter, and the rounded edge place over the surgical area and bite down to apply pressure. You will change this gauze once an hour until the bleeding has stopped. You'll know the bleeding has stopped because the gauze that you remove from your mouth will be brownish or pinkish in color and seem more saturated with saliva than blood. For the next 24 hours, we'd recommend rest. Rest will ensure that bleeding, pain, and swelling will be kept to a minimum. Please keep in mind that anything that increases your heart rate can increase your chance for bleeding and swelling. For sedation patients, we recommend bed rest. The less that you're up moving around, the less likely you are to become nauseous or sick. Your activity level for the next couple days will be based on your need for the prescription pain medication. If you are taking the prescription pain medication, you should remain home and avoid driving. If you are off the prescription pain medication, you may resume your normal activities. Patients who have had their procedure under a local anesthetic or a local anesthetic with the administration of laughing gas, your diet can consist of whatever you are comfortable chewing. For patients who have had IV sedation administered, we ask that for the next 24 hours you avoid dairy products. Dairy products have a tendency to upset the stomach and can cause nausea and vomiting. For IV sedation patients, we'd recommend foods such as ramen noodles, chicken rice soup, chicken noodle soup, any broth-based soup, Jell-O and applesauce, Slurpees, and slushies. The day after surgery, we'd like our patients to begin rinsing their mouth with a warm saltwater rinse. It is ideal to do this every 4 hours and continue to do so for 1 week following surgery. If you cannot do this every 4 hours, please be sure that you're at least doing this after meals and snacks. This will keep the area nice and clean and free of food debris, help promote healing, and help the stitches dissolve. The sutures Dr. Morrow uses are dissolving and will fall out over the next 2 to 10 days. You may resume brushing today, but avoid the surgical areas. After a full 7 days has passed, please take a soft, bristled brush and go ahead and brush right over the surgical area. This may cause bleeding, but will stimulate the gum tissue to heal faster. The following can be expected and should not cause concern. You will have slight oozing of blood for several hours. Swelling following surgery is normal and will reach its maximum in 3 days. You may have moderate discomfort, facial discoloration, your jaw may feel slightly stiff, and you may have reduced opening. If that is the case, please use heat and massage the area. Dr. Morrow should be contacted if any of the following arise: unusual discomfort, excessive bleeding, swelling, or elevated temperature over 101 degrees. To contact Dr. Morrow within regular business hours, please call the office. If it is outside business hours, please do not hesitate to use the paging number provided. If you do page doctor, understand this is a paging system. This is not a voice message system. After the greeting, you'll be instructed to leave your numeric message. You are to type in your phone number, including your area code, using your keypad. Hang up and Dr. Morrow will call that number back. If you do not hear from Dr. Morrow within 30 minutes of paging him, please continue to page until you do hear back. Should you have any questions regarding these instructions or your procedure, please do not hesitate to ask any staff member. Thank you for choosing Central Michigan Group, the office of Dr. Joseph Morrow.